We've seen a higher number of cases of cardiovascular events in young adults, in the young population recently, more than we have in the past.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hi, everyone. I'm your host, Johanna Gomez. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending health topics. Today, we're shining a light on the rising heart health risk young adults need to know about. We're breaking down the symptoms, the myths, and early warning signs that can help protect your heart long before adulthood surprises you. We're joined by Dr. Sergiu Darabant, cardiologist with Baptist Health Heart Vascular Care. It's great to have you here. And we've seen the headlines. We've heard it. It's a big conversation that's taking place where we hear that heart issues are now being linked to young adults. What is going on?
Johanna, first of all, I'd like to start off by thanking you for having me here in the studio today. We have a lot of hot topics to talk about.
Yeah, we do.
And it's a pleasure to try to help our young adults navigate their health and be there as a resource if the time comes. Young adults also need to focus on their cardiovascular health and health in general. Mm-hmm. We've seen a higher number of cases of cardiovascular events in young adults, in the young population recently, more than we have in the past. Okay. And there are some clear links to those trends.
Which are? What are the clear signs?
First and foremost, we've seen a higher incidence of cardiometabolic disease. And what that means is that we've seen more diabetes, more obesity in our young adult population, more stress levels, higher stress levels, I should say. And all of that can lead to higher blood pressure and worse food habits overall.
Yeah, which we will obviously break all of those down. When you say young adults, are you talking about people in their 20s, in their 30s, or even younger than that?
Mostly I'm referring to some statistics that discuss young adults between the age of 20 to 40. Traditionally, we expect cardiovascular events to be more proeminent after the age of 60. However, these days, as much as 20% of cases coming through the emergency department of those patients that have cardiovascular events can be young adults.
Okay. So for someone that is in their 20s or their 30s, what should be some of the early warning signs that they should look out for?
Younger adults have the benefit of most of the time being a little bit more active. So
I like that you said benefit there.
There's a benefit. Of course, not everybody is the same. And we do encourage that everybody is as active as possible. Mm-hmm. With those activities, it is a good way to keep your body in check in order to figure out if you have any unusual symptoms. What do I think of as unusual symptoms?
Yeah, right? That's the loaded question there.
The loaded question. Our heart works harder with physical activity. So you may expect to notice chest tightness, shortness of breath, out of proportion to the physical exercise that you're performing. Those would be warning signs for young adults where they should consider seeking an evaluation.
Okay, so a lot of young people don't know their blood pressure numbers, don't know their cholesterol numbers. Have you seen that I am totally calling myself out? So what should we be looking for number-wise, and when should we be checking? And is it really that important, doctor?
Yes, I believe the best form of medicine is prevention. The best form of treatment is prevention. Therefore, screening is important.
But you typically don't get screened when you're in your 20s or in your 30s. I mean, come on, let's go back to when we were that age. We were just living life, trying to get through school.
Of course, you're right. However, there is a higher number of people, especially those that come through my office, that are more interested in their health and are seeking preventive care, which makes me very happy, as that is one of my areas of expertise.
Of course.
But you're right. You're navigating through life. You're going through your education. You're trying to be present in a job, be present socially, and sometimes it's hard to find time to focus on your health and seek medical advice. So for screening particularly, I always encourage our young adults to at least have a primary care provider to see once a year. And there are current practice guidelines that recommend screening tests both for general health and cardiovascular health for people at every age. During those office visits, their blood pressure might be checked. And I do believe that it is nice to at least check a general blood work panel at least once a year.
Okay, yeah, that's a good rule of thumb. Once a year, go to your doctor, see where you are. It also just kind of gives you like a base of what you're working with. But what would you say are some of the biggest risk factors that you have seen in younger adults today? Could you involve stress, sleep, screen time, all of the above?
All of the above, I believe. You've listed some important ones. Screen time, that's an interesting topic. The more we focus on our important devices and technology.
I mean, it just takes over our lives, right? It has consumed us, and that's the reality. So
it can, and we're all guilty of this,
Absolutely.
No doubt. We have to use it both socially for our work, and then we can sometimes be entrapped by our technology. So what does that do? It takes time away from being more present, being more active. We could either choose to perform some physical exercises or choose to look at our phones just to relax. I believe the first would be better for our health. And just being mindful of how much time you spend locked in with some of these devices.
Right. Sleep is a big thing. When you're young, you don't get a lot of it because you've got a lot going on, especially if you have a family, right? And you have a young family, you're in your 30s, and you're just trying to get everyone together. What's the correlation between seeing a lot of like the risk factors being correlated to sleep? Sleep
or lack of sleep, rather.
Lack of sleep. That's really it, yeah.
Can increase daily stress. With higher stress levels, we have higher blood pressure. Our food or eating trends tend to worsen, and we compensate by eating the wrong foods, by trying to find. Well, I was going to say find joy in other places that where it's easy to find joy. And those are those escapes that we just touched on, social media and screens. And it's more important to focus on sleep, the right eating patterns, and that reduces stress levels, and therefore that can lead to better choices during the day.
It's funny, I call it brain rot in my house. Like I just need a minute to brain rot for a little bit, reset and find that joy, which sometimes it's okay, but finding that balance,
of
like
course.
You said, is everything. But when you are young and you feel pain in your chest or your arm, your heart is racing, you don't really think that there's anything really happening to you at that moment. What are some of the signs that we should say, okay, if you feel this is when you should go to a doctor right away?
Certainly, chest tightness with activity would be an important symptom to watch out for. Palpitations, which is a feeling of having very fast heartbeats within the chest. Having those at random, of course, would be a warning sign. Many younger adults experience palpitations with anxiety, and those symptoms are hard to dissect, and a doctor would help dissect those scenarios and see if anxiety is leading to palpitations, or sometimes you may have an irregular heartbeat that should be taken care of.
Have you seen a lot of your patients come in that are obviously younger come in with anxiety that then could eventually lead to some heart issues?
Anxiety will lead to stress. And certainly I've seen a lot of younger patients, and patients in general report anxiety. Unfortunately, we're all very busy in our daily routine, and our bandwidth is challenged with so many things. So we will all feel anxiety at different levels. And it's hard to to battle anxiety, and we have to learn within ourselves what helps and what doesn't. Sometimes a medical provider can help guide you with managing anxiety, but high levels of anxiety and stress can lead to higher blood pressure. And that can worsen your cardiovascular health.
Okay, so another big question that we found online was, if I'm young and I work out, I'm automatically protected from any heart issues. Can being active still come with risk?
It's very important to remain active, and that does decrease your overall cardiovascular risk, and it does set you up for success. However, some of us are just played a bad genetic card, and being active alone sometimes doesn't overcome that. It certainly does help, and general lifestyle does matter. But when we're talking about prevention and realizing what type of risk factors are going to challenge our health later on, a doctor can identify those family risk factors and make better recommendations as far as how you could combat them.
Okay, many moons ago when I was in college, I had a awful diet. Okay, I will be very honest. My lifestyle was just running from one place to another, and I was eating a lot of high processed food, which then led me to have a high cholesterol, which I was aware of at that wonder. And I really just shrugged it off because I said, I'm kind of young, you know, how much does that really start affecting, like the buildup, I should say. You're young, it affects you a little bit, and then all of a sudden you creep up, you blink, and then you're in your 40s and you're like, oh, I'm kind of in the same spot. And how much does that really affect your heart when you start having that lifestyle at a young age? I have gotten better before anyone starts judging me.
Yes, those that are like myself, closer to the age of 40, we tend to start focusing on our health a little bit more. And I think discussions like this are so important because they raise awareness to our younger adult population, because it's never too early to start being healthy, because those trends down the line can affect you. However, yes, younger adults have a little bit more protection because they're a little bit more active. And let's say that they have the gift of time. Things haven't caught up to them yet, as you might say.
Yes.
But that doesn't mean that health habits do not matter. And everybody, and this is general advice, when we look back at what we could have done at an earlier age, and you mentioned a good example, we think back that maybe it wouldn't have been a bad idea to focus more on our health.
What is that? Could have, would have, should have.
Could have, would have, should have, right? but hopefully this is why we're here, to raise that awareness.
Definitely to raise that awareness of what people need to know to get that going. And I also think it's just harder to break a bad habit, right? Like that is just as hard. Like you have to really train yourself from like making those lifestyle choices of eating good. Just not as easy. Everyone talks about doing a diet. It's hard to implement those lifestyles.
You've made a tremendous point, because why is it important to focus on our health earlier on? It is to develop that consistency. And I believe consistency is key. Being consistent with a lifestyle that you can carry on forward for the rest of your life. And that is what I encourage everybody to think of, whatever stage they are at in life. What is your ideal lifestyle from this moment onward? And that's why I would never recommend crash diets, as they are effective perhaps in a very short period of time. But then we all go back to our earlier trends.
We do.
Consistency is key, and we want balance in our life. That doesn't mean that we can only eat or should eat salad every single day.
Now it also gets boring.
3 meals a day. But we want to find habits that we can follow for the rest of our life.
Yeah, that's good advice there. Okay, so this stat actually surprised me a lot. A lot of people as well. According to the American Heart Association, about 1 in 20 adults ages 20 to 44 have coronary artery disease. So my question is, why do you think it's happening so early, and what should we take away from that?
Unfortunately, it's happening because our society has taken on worse habits over the past decade, I believe. Most of that is is caused by ultra-processed foods. We've briefly touched on that earlier. Ultra-processed foods leads to our patients having higher cholesterol levels. I had touched on the fact that there's a higher prevalence of obesity in our population and our young adult class, which leads to diabetes, which is a major cardiovascular risk factor. It leads to higher cholesterol levels, which is, again, another cardiovascular risk factor, higher blood pressures, which can cause small microvascular tears in our arteries, leading to higher cholesterol levels and atherosclerosis over time. All those things because of a change in our lifestyle.
Yeah.
And I believe that's where the higher incidence of cardiovascular disease in our younger population comes from.
What tip do you have for young adults?
Be mindful of your health and think of, as I mentioned before, think of what you would like your life to look like.
Your older self to look like?
Think of what you would like your older self to look like for the rest of your life. And try to find that balance early on because it does matter.
Yeah, some people think, though, if I have heart disease, heart issues in my family, I'm kind of done, Like, I'm just going to toss the towel up and say, is it really going to matter because genetics versus, your lifestyle? How much of that can really play a part?
Genetics plays a small part. The card that we are dealt can be managed with the right advice and help from your provider. So certainly, we're all born different. Some of us have family history, and it is within our genes that we may have a higher cardiovascular risk. A cardiologist like myself, a preventive cardiologist focused on longevity, can help determine how much of the cardiovascular risk comes from genetics or from other patterns during a daily routine.
Right.
We dissect all those things and try to reduce risk as much as possible through a conversation, sometimes medication, but at least that conversation brings awareness early on.
What's one realistic habit that you want young adults right now to start adopting into their lifestyle? Because you're juggling school, work, stress, life, family, et cetera, et cetera. It keeps going.
I can say this from experience. I think you could as well. And most of us in this room say that life just gets harder and busier.
I'll say that again.
Every year that goes by.
Yeah.
So finding a way to balance all of that early on can be the key to success. And incorporating physical activity throughout all that noise, I believe, would be the best thing that anybody can do. Staying active throughout this busy life pattern.
Yeah, for sure. What do you have to say to someone who's young and they say, I just feel too healthy to see a cardiologist and maybe I don't have to get screened? What do you have to say to them?
That may very well be true, but you will never know for sure until you have a good conversation with somebody that focuses on prevention of cardiovascular disease.
Yeah, I think the biggest takeaway, thank you so much for this great conversation, Doctor. It was great to have you here, is I guess get that yearly visit in, right? So you at least know where you're starting, what you're working with, and make those changes.
Exactly. And sometimes just being reassured that you are an extremely healthy person keeps you positive about what you're doing and encourages you to maintain those trends. Yeah. So it's never a bad thing to have a professional tell you you're doing an amazing job. And for that reason.
Before I let you go, one thing that young adults and all adults like to do is have some alcohol, finding that joy, as you say. We spoke about this, how it's recommended that we don't drink at all. But as a young adult, you're going to experience a little bit and push the boundaries. Would you say 1 to 2 drinks a week?
You're putting me in a tough corner. No, certainly I wouldn't recommend, there's no clear recommendation that you should eliminate all alcohol altogether. Alcohol has its roles, especially in a social platform. It keeps us social. It keeps the conversation alive between friends. It keeps us talking to each other rather than doing something else, perhaps. But everything in moderation. A few drinks, as you had mentioned, 1 to 2 drinks a week may not be detrimental to your health, especially if you're balancing it out on a social platform, as I mentioned before. Yeah. But everything in moderation, and certainly keeping in mind that more drinks can affect your health, lead to worse food habits and poor sleep, as well as sometimes giving you the sensation of palpitations, anxiety. Yeah. So we want to be cautious with how much we drink.
Well, thank you so much for your honesty. I really appreciate it. And for all your insights, for sharing with our audience. Remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching, and be safe out there.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.